Hello, and thank you for joining us today for this contagion program. Although it was declared eliminated in the United States in 2000, measles has once again captured the public attention as the number of outbreaks surges across the country and globally. We continue to see alarming statistics. But a discussion about measles is more than just a discussion on the disease itself. The current outbreaks involve the issues of vaccination, individual state laws, exemption definitions, and the role of clinicians and public health officials. We'll cover a lot of that today. I'm Dr. Glenn Fennelly, Professor and Chair of Pediatrics at Rutgers, New Jersey Medical School, and a pediatric infectious disease specialist.
Hi, I'm Dr. Tina Tan. I'm State Epidemiologist and an Assistant Commissioner with the New Jersey Department of Health.
Thank you, Tina. Today, we're going to have an important conversation about the current measles outbreaks. Let's get started. Why is measles such a public health threat?
Well, measles is one of these diseases that has been around with us just in general for many, many centuries. In fact, dating back to the 7th century that this was described back in the literature was the first reference. And, it's made worldwide impact before the vaccination era. And we describe the vaccination era as anything starting after 1963 when the first licensed vaccine was made available. There were something like about 500,000 reported measles cases in the US every single year, and about 500 deaths also reported every single year. But we believe that's also an underestimation of what we were seeing here in the US, like where there were probably millions of cases of measles during this pre-vaccination era. So measles still is an issue, as mentioned a little bit earlier. We're seeing measles worldwide. The epidemiology of measles is that, it still does exist in many places of the world right now. And we just have to be aware of this and recognize that this is a vaccine preventable disease. We have tools in our armamentarium to try to combat this.
Very good, very good. And I think it's important to note that the transmission of measles was eliminated in the United States in the year 2000 in the wake of a major outbreak in 89 to 91 that was upwards of 50,000 cases total. And since then, all of the cases have been linked to imported cases, mainly among pockets of sort of under-immunized populations. Why is measles such a threat, such a concern? There's a very, very high incidence of complications. Children, about 1 in 10 can get a severe ear infection, otitis media. It can cause deafness. About 1 in 20 will get pneumonia from a bacterial superinfection. And that's actually the major cause of death. Measles can kill 1 to 2 in 1,000. And in populations that are immunosuppressed or are malnourished, those rates can be much, much higher, as high as 5% overall or higher. It can cause an encephalitis, which in many cases causes severe sequelae in about 1 in 1,000 cases. So this is why we have to be vigilant. These can happen to any child anywhere that gets measles. Where are the current epidemics in the US? It's hit several states. We had outbreak in New Jersey at the end of last year, which we'll discuss a bit further later on. Ongoing epidemics in New York. In New York City, there's been more than 90 cases in the last couple of weeks reported. 90% of these kids are unimmunized. Now we're seeing outbreaks in Washington, Oregon, and I hear most recently Texas. Internationally, there is a major epidemic in Europe that's been going on over the last year, about 85,000 cases, more than 70 deaths. Even though, paradoxically, Europe is at its highest in terms of rates of immunization, 90% first dose, 95% the total 2-dose recommended regimen, still there are pockets of vulnerability that have allowed this to be possible.